Aloha and welcome to AlohaCare's virtual COVID-19 Town Hall webinar. My name is Paula Arsena. I'm the Vice President of External Affairs here at AlohaCare. We thank you for joining us today. Today's webinar is the first of a series that focuses on topics important to Hawaii's health safety net community for addressing the COVID-19 pandemic. Our goal for this series is to provide a forum for actionable information that enables us to together do our part to end the pandemic. A quick overview of our agenda today. We'll start with introductions by AlohaCare's CEO, Francoise Culley-Trotman. Lieutenant Governor Josh Green and Honolulu Mayor Rick Blangiardi will each make their remarks, followed by Q&A, which will be facilitated by Trish LaChica, AlohaCare's Community and Government Relations Manager. We thank those who submitted questions in advance with their registration. You are also welcome to put your questions in the Q&A box during the webinar. We'll do our best to accommodate your questions. However, due to time limitations, we may not be able to get to all of them. Now I'd like to introduce Francoise Culley-Trotman, AlohaCare CEO. Francoise joined AlohaCare as our compliance officer in 2017. Appointed CEO in 2020, Francoise has distinguished herself as a leader who emphasizes a team approach to the COVID-19 pandemic and all the work that we do, focused on engaging members to participate in their healthcare. I'd like to now hand it over to Francoise, who will introduce our guests. Francoise?
Thank you, Paula. Aloha. I'd like to extend a warm welcome and mahalo to everyone joining us today. Our audience includes honorable speakers, valued employees, healthcare providers, our social services organizations, and many others who share a common goal of improving healthcare for the approximately 427,000 Medicaid beneficiaries across the islands. In the beginning of the pandemic, I was able to witness the tremendous impact of community collaboration. Just over the past year, AlohaCare joined our peers and partners to help keep our community safe and healthy. We responded to healthcare providers' need for thousands of PPE, sponsored monthly food distributions, implemented a vaccination campaign with incentives for our members, and more recently, requiring vaccinations for all AlohaCare employees. We're very hopeful that this series helps to support continued and meaningful progress towards a healthier community. So on behalf of our members and the AlohaCare team, thank you for all your perseverance and resiliency. Before I introduce Lieutenant Governor Josh Green and Honolulu Mayor Rick Blangiardi, I would like to thank them both for their leadership in addressing the pandemic. We are very grateful to have you with us today. So first, let me introduce Lieutenant Governor Josh Green. Dr. Josh Green became Hawaii's 14th Lieutenant Governor in 2018, as you all know. His service includes 14 years in the Hawaii legislature as a representative and senator, serving the Kona and Ka'u districts on Hawaii Island. At the onset of the pandemic, Dr. Green was named the state's COVID-19 liaison, leading the effort to curb the spread of coronavirus in Hawaii. In addition to the pandemic, his office tackles homelessness, healthcare disparities, statewide medical staff shortages, and lack of affordable housing. Dr. Green first came to Hawaii with the National Health Services Corps in 2000, beginning his work as a family and ER physician in rural hospitals and clinics on Hawaii Island. Today, he serves as an ER physician twice monthly on weekends on Hawaii Island. So Dr. Green, mahalo for joining us today. Thank you. Next, I'll introduce Mayor Rick Blangiardi. Mayor Rick has led the city and county of Honolulu, the 11th largest municipality in the country, starting in January 2021. His top priorities include the health and economic impacts of the COVID-19 pandemic, of course, affordable housing and homelessness, public safety, the rail, elder care, and modernizing services with technology. Prior to becoming mayor, Mayor Rick, he was an award-winning media executive for more than 4 decades in Hawaii and also several competitive national markets. Mayor Rick has been extensively involved in Hawaii's leading nonprofit organizations, educational institutions, and youth development programs. He's also a veteran of the United States Naval Reserve, amongst other many impressive qualifications. So mahalo for joining us today, Mayor Rick. And welcome again to our speakers. So starting with Lieutenant Governor Josh Green, you will each have about 5 to 10 minutes to make initial remarks. So at this point, I'll just hand it over to you, Dr. Green.
Well, thank you. Thank you, Francoise. And please call me Josh, and I hope everyone will do the same when they ask questions. A couple housekeeping things. First of all, let me extend my most heartfelt happy birthday wishes to Mayor Rick, who I'm exceptionally fond of, who has done a great job jumping right into the fray. So happy birthday, Rick. And
Thank you, Josh.
may you have many, many happy birthdays to come. I'm sure you will.
I certainly hope so. Yeah, that's the game plan. I'm counting on more to come. Yeah, this is not the last one.
I love it. But first, your first birthday as a mayor, which is great. We're happy to be with you. And I'll tell everyone this one more time. It has been a great pleasure working with you and your team. They're so accommodating, so open to sharing thoughts and pushback and new ideas. And it's a really good experience. So thank you for that leadership, Mayor.
Well, it's right back at you, Josh. You're great to work with. Everybody knows that. So thank you very much.
Thank you, brother. Okay, so another quick last housekeeping thing for AlohaCare, and then I'm going to dive into my comments. AlohaCare did something special when I first was elected to the State House. They stepped up and gave $250,000 grant to us in Kona to open a community health center, which was a tiny little hole in the wall run by the Catholic Charities and Salvation Army Clinic, which I was volunteering at. That little place, which was sponsored by your first grant, now employs like 150 people and is the West Hawaii Community Health Center and is at the tip of the spear and getting people vaccinations and treating COVID in on the west side of Big Island. So your gift to all of us has come full circle. So I want people to understand that all of this long-term healthcare work that you guys do and have supported is paying great dividends here now, I guess 16, 17 years later. It really matters. And so there we are. I mean, it's something that we'll talk about as to how we're responding to COVID. But good on you guys. You're phenomenal. Okay, so Francoise, thank you for having me. Gary, Paula, Trish, good friends. This has been a roller coaster ride for sure, the pandemic, for the last 17 or 18 months. An extraordinary experience that many of us never thought we would see. But because Hawaii has one of the best healthcare systems in the country, due in large part to your contributions over the years, we're constantly ranked the healthiest state in the country because of coverage for everyone in primary care and community health centers and so on. We've been able to weather the storm, although it has been a storm. From the time when we first knew COVID was coming in early 2020, if you will, until today, we've had 73,000 plus cases. It's 73,268 confirmed cases, and very likely another 150,000 individuals have had COVID. I was one of them. My son was one of them last week, and he's fine. But it happens. He's not vaccinated because he's only 10 years old. I caught it last September before we had any immunity from vaccinations. But so many people have experienced COVID, and some in a minor way, and some severe cases, as we know. We've had 671 fatalities, which is heartbreaking. Almost all of our fatalities, 98% of our fatalities, have been amongst those who are unvaccinated, which again hurts because we're all about preventive healthcare at AlohaCare and HMSA support and Kaiser, everybody who works together as a team. But you guys, more than most, because you're so supportive of the community health center system, really you are the heart of it, have helped save thousands and thousands of people. For every 100,000 people that receive immunity, and we've now vaccinated 1,054,000 people out of our 1.2 million who are eligible right now. That's 87% of the population who is eligible, has at least started the vaccination. For every 100,000 people, we know that about 500 people's lives are saved and about 5,000 hospitalizations are avoided. And that's incredibly important because we know that we've had, through the pandemic, a lot of hospitalizations. It's like 3,700 or so hospitalizations total. Can you imagine what it would have been like, knowing how full our hospitals are right now, had we not vaccinated our community to such a great degree? And I'll defer to the mayor to talk about, the very strong policies that he's been implementing, even just early in a term of service. But the unimaginable consequence of having what could have been 5,000 hospitalizations times 9 or 10, that could have been 50,000 people in the hospital. And we had projected initially 4,479 lives lost had we let the pandemic just roll through Hawaii. So we took pretty extreme action early. We shut the state down last March, now well more than a year ago. 99.6% decrease in travel to Hawaii, which was, of course, devastating economically, and we have had to recover, and we have recovered quite a lot. But it saved those 4,000 plus lives. And all of the work that you guys have done to support providers has been immeasurably important. It's just so valuable because you've kept practitioners going, and we've been able to therefore see, and I don't want to use the word only, we've been able to see 671 lives lost when we would have had all those thousands. We've had a roller coaster 3 times now. We had it last July 4th, then over January 1st and the Christmas holiday, and then, of course, over July 4th this year. This latest one, because the Delta variant has been extreme, but it would have been far worse had we not had, and our numbers as of today are 65.8% of our population, entire population vaccinated. 74.1% of all of those in the state who are eligible have become vaccinated. And then 87% have started it if you expand it out further. So it's something to behold. We have come down, it looks like, on the other side of the mountain. A month ago today, I was comparing for some of the team. A month ago today, we were in much more dire straits. Even 2 weeks ago, we were at 850 cases per day. We're now back down to 550. A month ago today, we stood on the same spot, if you look at it as a rainbow. In other words, a month ago today, the positivity rate was 6.7%, and then it rose up to 9% and has come back down to 6.7%. A month ago today, we had about 350 people in the hospital. It rose to 448, and it's come down again to 346. But of course, over the course of that month, we've had loss of life. We've had 119 fatalities in the last 30 days. And that 119 fatalities, for perspective, represents 22% of all of the fatalities that we've had for the whole 18 months. So this is what happens when the population who are unvaccinated are confronted with a very infectious Delta variant. And that's how it's kind of run through us. And I don't want to go too long because I know that Rick and I we are 2 of the people you'll find eager to take questions. But it should be a reminder that 1 out of every 500 Americans have lost their life. Now, we have the second lowest mortality rate in the country, second only to Vermont. So we are far, far lower as a percentage, but it has been so impactful. So I will just kind of pause there because it's a lot of information and finally say, once again, I'm thrilled to be able to work with Mayor Rick because he's just a thoughtful leader. And I won't, we even have some differences of ideology, not many, but some, but it's actually good because every once in a while I push too far one way and he pushes back. And every once in a while he nudges me and it gets me, I think, to a better place. So I think this is the way it's supposed to work. And we appreciate all of you guys for pitching in so much. So why don't I pause there and hand it over to our mayor.
Thank you, Josh. And let me just first of all, thank you, Francoise and Paula and Trish and anybody else who's on this webinar wants to spend the time with us, listening to us. I think that Josh saying we're eager to ask the questions is a euphemism for we like to talk. But that said, there should be a rule that, nobody has to follow Josh Green talking afterwards about COVID, because as you can see, the man is a wealth of information. In fact, he's one of the sources every day. We receive multiple text messages that I defer to, rely on for really updated information on what's happening all the way across the spectrum from, case counts all the way through every important data point regarding. So let me just start off just personally. So we have 5 minutes to just spend a minute or so, just a perspective on me, because I looked at some of the questions. They're sort of like challenging in a sense of like, what is it you do that sort of gives you a perspective or an education or understanding of a need. So just to put it in quick context, as Francoise said, I came into my decision to run for mayor came after a 43-year career in media. And 30 of those years were here in Hawaii, and the last 10 or so were as the general manager of Hawaii News Now. So, a lot of my inspiration to run for office, not saying anything I'd really anticipate, just so my birthday is today. It's my 75th birthday. I was 73 years old when I made this decision. Not what you're supposed to be doing in your supposed retirement years, but nonetheless made the decision and we won, and here I am. So, but that said, that lens, if you will, through a newsroom was a tremendous lens, if you will, purview on a lot of issues affecting our community, not the least of which was homelessness, which probably had more than anything the major reason why I decided to run, because of a lot of frustration, the work that we tried to get done, things we tried to accomplish. I'm joined today by Anton Krucky, sitting just 2 feet from me. I'm extremely proud of, and the work that he's done in just our first 8 months, and irrespective of what got said yesterday in the paper, we are really on a good path, a solid path going forward. But that lens, if you will, combined with the fact that I was also blessed and fortunate as a member of our community in that role to serve on a number of nonprofit boards over the course of years, and really got to understand at a very base level, if you will, the work that they did, my respect for the work that they did, the profound need for these organizations. You've begun to look at Hawaii as a very fragile place. And if it wasn't for the dedication and hard work and sacrifice of so many people, so many unsung heroes really stepping up each and every day to make a difference, you often wonder what's going to happen. I know Josh just speculated a little bit on some of what could have happened things with COVID. I also looked at the community that way. So I think that I've been sensitized as somebody who came into office saying, I'm not a politician, I'm not building a political career. I was inspired, really, quite honestly, by that background, if you will, of issues in the community, being an active member. But then, we also announced we were going to run in February of 2020, and a month later, COVID hit. And so we weren't new to the idea of a pandemic coming in. We got sworn in on January 2nd, nearly 9 months ago. But since that time, I can tell you that COVID has been, while we've tried to get ourselves going on all the many issues the city was facing, has been a major distraction. In the last 60 days, it's become almost all-inclusive, if you will, how many hours a day are spent on this issue. We'll talk about the policies in a second. But that said, we've migrated. If I could just sort of compliment, because Josh has so many great data points that he just shared, and I'm sure there'll even be more. But if you think about it, when we came into office, the focus was on case counts. This is going back to the start of this calendar year. And it was a lot of case counts, positivity, and at the same time, we were looking at the fact that Hawaii, even though we had shut down our economy, which was very costly, the reward for that was we were being spared, if you will, low hospitalizations, the best in the country, lowest mortality rates, et cetera. And all of that was really good. Very little pressure on our ICUs. I think at one point, the peak of the first phase of COVID was at 200 cases, and then it quickly went down. So all was looking good right up to the point just 2 months ago now, July, we're going into the 4th of July weekend, and it was a pivot. We went from counting case counts, this really happened during the month of June, to really vaccinations and vaccination levels. And if you all remember, we were approaching July 1 with some speculation of possibly even dropping all restrictions. Governor chose not to do that. They waited till July 8th to make an announcement. In the course of that time, they came out with the tier 5 model, which is anything I wasn't aware of, but it was pretty much at 65%. We'll drop these restrictions, and at 70, which looked inevitable, it'll just be a question of time. We think we could drop all restrictions. If you remember, that was about 6 weeks ago. We were talking that way. And so it looked like we were out of the end of the tunnel, and it was really good for us. And we were feeling excited about that as well, because we felt like maybe we had just endured the worst. And quite honestly, since we've come into office, as a result of the fact that our economy was shut down for the 9 months prior coming in, that, economic recovery and all the aspects with it, distribution of monies, rent utility relief monies, a lot of things that we have done that have, really almost been on a humanitarian relief program, we're all being, we're all feeling really good about that. We felt like, well, maybe we held it together and long-term back. But then COVID starts to hit around, I guess, somewhere that Delta started to hit. And suddenly, the one thing that we knew was the important metric, our healthcare systems and those healthcare providers and everybody else was under siege. And as Josh just pointed out, I think in the last 60 days, we've had more than half of all the cases that we've had since the pandemic began in just that amount of time. And of course, what that brought with it was incredible pressure on our hospitals, healthcare providers. Fortunately, we were able, for the first time in the pandemic, get some 600 plus FEMA workers here. More are still yet to come. But our hospitals were at capacity, and it was very legitimate. And Josh was involved with me, with the principals across the board, and we became really concerned. And not only that, our fatalities were rising, and people were seeing what I think everybody feared at the outset of this disease that never really manifested itself. We're now living that situation. And so the weeks of late have been really focused on that. And so that led to the decision making, because as I said, it just happened in the last 6 days. So we start out first and foremost about mandatory vaccines for all of our employees, because fundamentally what I wanted to do, and the one thing we could absolutely control, was to make sure all of our employees and their families, their respective families, given the high level of transmission of this disease, would be protected, number one. Secondly, and even though that was different than the other counties, and quite honestly, the state at the time, we thought that was a statement we could do, plus make our contribution from a leadership standpoint at hopefully reducing the pressure on our hospitals. Okay, that then led to, okay, what next? We looked at, communal spread, we looked at large gatherings, and we felt that that was something we could do. And so when we made a decision for 28 days, which began on August 25th, ends on September 18th, we had to cancel 194 scheduled events, all of whom had applied for exemptions, and they had procedures, they had all the protocols, and that was not without consequence, because we had 26 of those events actually were more than 1,000 people, and there were a lot of others at more than 500, and so on and so forth. That was not a small sacrifice to ask of the community. We didn't take it lightly. There was a lot of economic ramifications to that, but we did that because we felt that as a mitigating factor, the large gatherings were the possibility of really contributing to communal spread, given the rapid and infectious nature of the Delta variant. The next thing that fell on our lap, as it turned out, even though it really was my negotiation with the Department of Health, was to notify the University of Hawaii that, and again, it's going to be true this weekend as well, that they weren't going to be allowed to have spectators. And just to put it in perspective, and since my background is in sports, Francoise didn't mention that, but that's where I was rooted. I spent my 20s as a college football coach. But I've been really involved with that program. But the University of Hawaii, it was the only Division I program in the country this weekend that played in front of no spectators. And I don't know how many football fans are on this call, but if you watched any kind of football over the weekend, be it college or certainly the NFL, you saw stadiums packed across America, people not wearing masks, and so on and so forth. And it really seems incongruous. But again, as a community step, we decided that we just weren't going to allow that kind of large gathering. So we've gone across the board with no large gatherings. Now, we'll probably extend that 28 days because it's coming up next week by 14 days. We're trying to just navigate our way through this. And then the last thing we came up with and said, okay, what else can we do to help manage this, was a safe access to water. I know there's a couple of questions about that and why we did that. And we took a page, we looked at what was happening in other major world-class cities, and the ones that came up were New York, San Francisco, New Orleans, and even Guam had done something like that. We worked closely with the restaurant associations, but the reason why we came up with that is it really had to do with the fact that the second largest group of communal spread, the clusters, was coming out of restaurants, bars, and gyms, even, and next to the correctional facilities. We had no say in the correctional facilities, but this was something we thought we could implement and to make it so these businesses could continue to stay open. Josh will tell you, there was a lot of noise about closing down everything. That's how big the pressure was. It was very real. We were pushing back, going back again to economic recovery, saying we cannot do that. That's irreparable harm. We won't do it. But and hopefully will prove to be right. But this was a step to allow businesses to continue to go, to allow people to continue to thrive as we work our way through this. So these were all mitigating steps. None of them were done for political reasons. They were all done in the best interest of communal health and trying to do what we could do from the city perspective, starting with our own employees across the board to protect everybody, to get us through this period. So I'm relieved that a month later, as Josh just said, where we are, the numbers seem to be coming down. But I'm still a little bit nervous because I feel like we're at the table negotiating with this disease right now, and we haven't won the negotiation yet. And that's where I'm at, and I think we'll turn it over on that. Okay.
Great. Well, thank you so much, Dr. Green and Mayor Rick, for sharing your insight, your priorities, and working so hard on our behalf. Next, I'd like to turn it over to Trish LaChica, our Community and Government Relations Manager, to facilitate our Q&A portion. Trish?
Great. Thank you, Paula. Hi, everyone. Aloha, Mayor Rick and Dr. Green. We'll start with the questions submitted via registration, and then we'll get to a couple of questions submitted via our Q&A box. So the first question is for both of you. As you know, our attendees today make up the Hawaii's healthcare safety net community, and we have been through this in the last 18 months or so. So what is the best way for us as Medicaid health plans, leadership of those health plans, and our providers to support vaccination efforts and your priorities in particular? Can each of you share and respond to that question? Thank you.
Yeah, Dr. Green, I defer to you, sir.
Oh, thank you, Mayor. Well, one of the things that jumps to mind is to continue to provide extraordinary services at the community health centers. Those are very great hubs for us to provide the many things that our community needs. And there's such health disparities in our communities, as we know, for those who are on Medicaid. So some of the tough realities are that vulnerable populations have really gotten slammed by COVID. For instance, the Pacific Islander community, just like 4% of our population, but 16% of our cases and lots of deaths. Hawaiian community, 21% of the population, 24% of the cases. So these are the communities that we've always been very focused on serving at the health centers. So I think if you can go the extra mile to help those vulnerable communities, that would be very impactful for us.
Yeah, and I just might add that we really rolled out a very comprehensive free testing program. We just spent over $16 million last week. We were going to be in those areas. We've got extensive, and you can find this all out on our website, but we really, we want to contribute in that regard, but keeping in mind that testing doesn't prevent the disease. It just simply tells you you're not sick yet. But we've seen in recent weeks incredible demand, which speaks a little bit to the fear and concern. Despite 87% of our eligible vaccinated people are vaccinated, still yet there's a lot of people really concerned because they've seen other people getting sick and people dying. I would just ask for some help in education. If there's a hidden enemy in this whole thing, it's been social media. I'll tell you, the stuff that's going on in social media and the misinformation that's out there and the stuff that people are buying into is pretty remarkable. And I'm not just saying that based on firsthand experiences. I get deluged with anything and everything from people who are against vaccinations to listening to people who just legitimately unaware, afraid, they've heard something they don't know. So I think part of the road ahead is asking ourselves, challenging ourselves, what can we do to help with educating people? Now, over the last 3 weekends, we've been averaging, Josh, correct me if I'm wrong, more than 30,000 vaccines a week.
Yes.
Let me just put that in perspective. That's sort of since the end of August till now, the middle of September. And ask yourself, if the vaccine's been around since the start of the year, pretty much, and we began the rollout of our program, how many months people took to actually make that decision? It took them a long time. And I still believe there's more to be had, and we need to get to a higher percentage than where we are already, given the nature of this. So we need every bit of help now, because these are people who've held out for a long time. Some never will. Josh alluded to that. I agree. I accept that. I've tried meeting with these people. I'm never going to reach them. But anything that you could help in educating on the safety and the effectiveness of the drug would be really helpful. Because I will tell you, the ignorance that's out there, and a lot of it's been spurred by social media and a lot of misinformation, has really proven to be something of it's really a formidable situation.
Great, thank you both. And speaking of, talking about misinformation. There's been a lot of talk about immunity and safety of the vaccines, but this question is for Dr. Green. Is there a difference in immunity between a vaccinated person and somebody who's already had COVID-19 or specifically the Delta variant? What are your comments on that?
There is a lot of different immunity. There's the natural immunity that you get from having the disease, right? You amass an antibody response, and it's to the specific variant that you have. But you do get broad immunity because most of the variants have a lot of similarities. But then the vaccinations themselves provide additional immunity to other parts of the virus. And we are told that you get 5 to 10 times additional antibody response by being vaccinated on top of having had COVID. So that's why we recommend to people, and I was one of them. So when I had it in September, I then had some modest amount of immunity. I don't know how much. It's difficult to quantify. But thereafter, when 3 months later the vaccine became available, my physician, I have a physician like everybody else, said, go get a shot, and you will get a lot of additional protection. And I think that we're seeing multiple layers of protection now. There's the social protection we have through social distancing, not having gatherings, wearing masks. There's catching COVID, which, 70,000 plus people have got some immunity. But then there's, of course, the massive immunity that we see from the vaccine. So it's something worth constantly reminding people of. And to the mayor's point, that's why we need all of this extra education, because I noticed that you have these other questions like, are we targeting other zip codes? We are. We're targeting zip codes like in Evo, where they're just wonderful people. We have Waianae Comp, but wherever there are socioeconomic disparities and sometimes education disparities, it's just harder to get people vaccinated. And it doesn't take much misinformation, which we sometimes get from political leaders, not Rick, but others, that sets you back. And so we go there, we're going out constantly, we're making so many different possible places available to get vaccinated, yet you still can sit at 40-45%. And I'll close with this statement. The whole country is a microcosm of what we are. So we have some parts of our state that are 80-85% vaccinated, and others that are 35 to 40%. Just like our country, go to Connecticut or Vermont, they're the only two states I think that are consistently ahead of us with vaccinations. They're almost completely vaccinated. And if you go to Alabama or Texas, they're unbelievably vulnerable. So it's education.
Thank you, Doc. And then quick follow-up to that, do you have any update on when the general public or others can start to receive boosters?
I do. I have a real-time update. The FDA just moments ago came out neutral, which is interesting. They did their review and they came out neutral on their recommendation, which means it will go to the broader community in 1 week to decide whether or not they're going to recommend the booster. It's contentious because there is a lot of immunity from the first 2 shots, and their consideration is that there's a finite number of vaccine in the world where other communities and countries are so unvaccinated right now. Parts of our country that are, only 40 or 50% vaccinated, that haven't even gotten their initial doses. I think ultimately they will approve at the end of the month a 3rd shot from Pfizer, and then a week later or so, a 3rd shot from Moderna and a 2nd shot from Johnson & Johnson. So the way that I've heard it spoken well is that we should do both. We should be as healthy as possible as a country so that we can go out and participate in making other places across the world safer. And it's a resource question there. And we do, have more resources than most. So that's how we'll approach it. But I would expect that it'll be an 8-month interval between the 2nd shot and the booster that people would get. And right now we already are offering booster shots to some people. As of this morning, we had done 11,141 3rd shots for people that have mostly immune compromised, although some people do just show up and make a compelling case to get a shot, and they get it sometimes.
Thank you. The next question is for Mayor Rick. Mayor, it's been a little over 2 days since the implementation of the Safe Access Oahu program, and I know neighbor islands are considering as well. So as a pilot, what have you been hearing as, both the positive and challenges with the program, and can you comment on the implementation so far?
Well, it really is early to make a comment on how well we think it's going. I can tell you it's been embraced very well. We've had a lot of good feedback. We even talked to a couple of restaurant people. In fact, one of them had dinner at my home last night. I'll just say his name, Peter Kim. He owns Signature Steakhouse. We have 20. He's a partner in 23 other restaurants. And he said that the business was down a little bit, but they're very confident it's going to come back. I got a really nice note from Peter Merriman from Merriman's, who actually took the initiative to have all of his employees and customers vaccinated. He got, in the beginning, there were protests there. Now his business is absolutely doing very, very well. So look, I work out at a gym. I was there yesterday. There was no drop off in the gym crowd. Everybody was there. And I learned from the young lady that checked us in that everybody was vaccinated. They were surprised at, the percentage. So I guess what I'm saying is that we think it's going to work really well. We put it in place for only 60 days with the understanding that we could pull it. If things were to take a precipitous decline, which could happen, and I don't want to sound like I'm being naive here, but it could happen, looking at other places, we would be the first to remove this, if you will, if in fact it was perceived as a barrier. But at the end of the day right now, I choose to look at the glass as half full, and that is if people will be more inclined to go and use these kinds of facilities if they can feel safe. Because I do think that the fear is unprecedented. I'm saying that because of the amount of testing we're doing from already vaccinated people. So that tells you out there that, even for that matter, talk about who gets a third shot or whatever, that's prevalent. So this program was designed to help ease that peace of mind.
Thank you, Mayor. And I can think Lieutenant Governor is trying to type an answer, but I was going to ask you the question that's in our Q&A box. I think we have about just a little under 10 more minutes left. So Dr. Green, what are we doing, as you know, to with everyone that's in the hospital and occupying beds, what are we doing to improve early outpatient treatment for COVID to help keep patients out of the hospital?
So there's two things. Before people get admitted, we are setting up antibody clinics, monoclonal antibody clinics, although it's a challenge because there's been a rush to grab all the monoclonal antibodies across the country. And the South has tried to grab 70% of them because they're obviously having so much more COVID without a good vaccination response. So now the federal government decided they're going to just spread them out equally. So now we will be an equal partner to get them. So we'll have 12 different sites across the state. And I think that the community health centers are participating very, very significantly in this movement. So monoclonal antibodies can help people with mild to modest symptoms to stay out of the hospital. Keep in mind, you can't be vaccinated for 90 days after getting monoclonal antibodies, just for what it's worth. And then we're also looking to have a lot of step-down discharge spaces. I proposed one. It just as an idea, it got dismissed a little bit, but we have to be able to, if we were to have a sustained large hospital number, we have to be able to discharge people to places that then still get some respite without being at home completely in the care of their family where they'd be overwhelmed. So the Hawaii State Hospital has not yet opened the new building. It's beautiful. We could use that or long-term care facilities, but they're more problematic because they, of course, are housing individuals that are elderly, may have waning immunity because it's been now 8 or 10 months since they've gotten vaccinated, and we can't afford to infect our elders, our kupuna. So, because the mortality rate's so high. So there has to be step down spaces. But the good news is that, the decline has been over 20% in the last several days from our peak hospitalization numbers. So I think Mayor Rick, he may be right. We may be seeing the decline now. We may be getting out of this fire.
Thank you, Dr. Green. The next question in the Q&A box, there's 4 questions from one person, and so I'll just read them out and then feel free to respond. Do you feel that the increase in numbers is due to opening up the economy or because of the Delta variant?
Let me take a shot at that, and Josh, you can certainly weigh in from your perspective. But before I do that, because I've read through some of the questions, I know we have over almost 150 people on this call. I alluded to our website, but I just want to give it out because we have a lot of people working on this. We've answered a tremendous amount of questions. We're taking some pride in updating it and giving people relevant information. So that's oneoahu.org, oneoahu.org/safe-access-Oahu. So it's, and Trish, I can text it to you later if you want to put it out, but oneoahu.org/safe-access-Oahu. Lots of good information there. So look, I've been on record of saying this. People very quickly want it, because when you say opening up the economy, the first thing goes to is the whole idea of tourism. And the fact of the matter is, this was a locally owned problem. Of the 73,000 cases that have been reported here in Oahu, about 1.5% of those, or for that matter, just really very few cases have shown up at the hospital that were tourists, and none of them required hospitalizations. So what's happened here is we had local people traveling, coming back, contracting disease, not testing, not quarantining. We've been our own perpetrators in a lot of ways as far as commerce locally than we have from the outside people coming in. Safe Travels Hawaii worked very effectively. And then the rest of it, quite honestly, again, it's just on how we manage it. And I think, candidly, so going back to the second part of that question, it's been the virulent nature, the infectious level of this Delta variant. It was like, unlike the other two strains, that I think is created a lot of stuff. I think here, we've done a lot of things to protect ourselves. It's a very compliant community, both in vaccination level, mask wearing, social distancing. We see a lot of compliance, but this disease is very aggressive. Josh?
Yeah, it's everybody who is unvaccinated but still gathering caught Delta. It's just the gatherings, and one could spin out other reasons for small numbers of cases, possibly a church here, or or an unlucky break there and a breakthrough case. But almost everybody I've seen, well, I will say this: everybody I've seen in the hospital has been unvaccinated. Every single patient that I've taken care of, and it's just the nature of these viruses. But come 22, 23, 2024, there will be more and more immunity that'll be deep into society, plus the vaccination process. So it will fall into the background like other infectious diseases do.
Yeah, and look, and the numbers speak for themselves as far as 98% of the fatalities are unvaccinated people, 2% are vaccinated. And while I'm not, and because of HIPAA rules, given any privileged information, I can tell you that just because you've been vaccinated didn't mean you're a healthy person going in. So if you looked at the common causes, comorbidity rates of those people who were vaccinated, among the leaders are obesity, diabetes, and respiratory ailments, which people had and they were vulnerable. And Josh, I don't want to get you in any strange territory as a doctor, but that's kind of the reality of it, and this disease is so infectious that, so nobody is bulletproof on anything. And it just so happened that those people were more vulnerable and unfortunately passed away. But the great number of people, the preventable deaths that we've seen, were exactly that, preventable, and they were unvaccinated people.
Thank you. So I'll ask one more question and then I'll turn it back over to Paula. So you both mentioned that, the pandemic, this is going to be part of our foreseeable future. So what do both of you feel that we need to do as healthcare providers and social service providers to continue to be prepared and also, continue to increase vaccination rates and keep those who are unable to get a vaccine, those 12 and under, and our seniors protected? Dr. Green?
Sure. I would say continue to beef up our healthcare system. This is a time where, coming through a pandemic, everyone sees the value of public health, especially more than ever. And I know this is an area of expertise for you, Trish. You've been terrific. That's the thing to do, to build the system and to be ready for the out months and the out years. There's going to need to be a lot of social work, a lot of management, a lot of primary care capacity being expanded. We've basically spent 2 years kind of in a low-key, almost hibernation state as far as going to our primary care providers. That's a problem. So there will be a lot of healthcare to catch up on. And I'm speaking, of course, today, specifically about that because this is an AlohaCare audience and healthcare professionals. But we have to be ready for the aftermath of this pandemic. There will also be long COVID to consider, which probably will affect somewhere between 10 and 30% of the population that had COVID. And then finally, let's use this opportunity and try to find a silver lining where it's pretty extraordinary that 87% of the eligible people have gotten vaccinated. That's incredible, really. And so this is an opportunity for us to double down on good public health. So all those things are relevant. And then the last thing I'll say is we just should be a little bit vigilant because, God forbid, we get a variant that evades our immune capacity. It should not happen. We haven't heard that that's going to happen, but we don't want to have another 2-year cycle. So it would just be simply too frustrating for words. So prepare to expand the healthcare system. It is one of the best and most dynamic parts of our economy, and it's also one of the most important. So there's a lot of good work ahead for our teams.
Yeah, and I just go back to, ongoing education. We've learned a lot in this experience. We've kidded today about this being my 75th birthday. It probably makes me the oldest person on the call. I've never seen anything like this in 7.5 decades of my life, and what we've all gone through. And Josh alluded to the fact what we've lived through is, in some ways, some of us couldn't not have even imagined it, right? And so what have we learned? We were just reminded 4 days ago in the commemoration 20-year anniversary of 9/11, and I watched as much as I had time to be able to see, and the commemoration of that event was about lessons learned and things that happened since then. So as ongoing care providers, I would say we've learned a lot of really valuable lessons. The education of this has been costly, it's been painful, it's been ongoing. But let's not lose the benefit of those painful lessons taught, and anything that you can help, do and educate a public on a going forward basis will be tremendous. So that's what I would offer.
Thank you so much. I'll now hand it back over to Paula.
Great. Thank you, Trish. And thank you to both Dr. Green and Mayor Rick for spending your lunch and your birthday with us. Thank you again. And for all of your leadership that you've provided through this pandemic and for the coming days. And for our audience, we thank you for being so very active in your participation. There are many questions that we weren't able to get to for our employees. We'll post responses to your questions on Aloha Lines, perhaps even sending you some information from the city's website as the mayor has recommended. And we look forward to your participation in our next installment. Thank you so much, everyone. Aloha and stay safe.
Thank you. Aloha.